Let's see if it gets any better. Yeah.
Okay. Yeah, we gotta get people. Are people on Wi-Fi right now? Okay. Got it. All right. So the left is TikTok. This is Instagram.
Yeah, right is YouTube.
Right is YouTube.
Yeah.
Okay. Right, you guys, Dr. Barrett here. We are live. We're here in Beverly Hills, and we have kind of an Ask Me Anything question session going on right now. But actually, the first thing I want to talk about, because I got this question a lot. Here, let me see. Do you have a little off to clean this one right here? You can just grab my shirt, my sweaty gym shirt, right there. Behind the scenes. Okay, just clean that off. All right, that's much better. Okay, so I get a question about tummy tucks. Am I too big to get a tummy tuck? So if you're asking that question, you might need to lose some more weight. Okay, but it's not a hard set number or BMI that I follow. Okay, so a lot of plastic surgeons, they recommend to get to, you don't want to be over a BMI of 30, or some people even say 35. Now, BMI is a calculation of your weight versus your height. Okay, so you can calculate your BMI. You can actually plug it in online to a BMI calculator to figure out your BMI. Now, it varies. If you have a lot of muscle, it can be kind of different. But for most people, it's pretty accurate. It's based on your height and your weight, and it tells you your body mass index. And that's important because that's a relatively good ratio to determine how much overweight you are, all right? And then how underweight you are too. You can actually go opposite the spectrum. And of course, these are all relative averages. It's not set in stone 100% for everybody in terms of its meaning, 100% true meaning. But it's like a general indication of things. So BMI of 25 is perfectly fine. Once we go over 25, getting into 30, we're starting to get up there. A lot of people start to notice some of the articles and studies show complications that start at 30 and above. Definitely you start to see higher complications at 35 and above. Now, complications typically can include wound infections or seromas or problem with incisions. They can also relate to other side effects from anesthesia, because if you have a lot of fat tissue on board when you're going under surgery, it stores a lot of the anesthesia, so it doesn't come off as easy. Sometimes also there's breathing problems. It's harder to get the machine to breathe for you if you are a very big person. Okay, if you have a lot of intra-abdominal volume and you're trying to do a tummy tuck, that also creates a lot of problem. Remember, tummy tuck, we're tightening that up. That's your space to breathe. Your diaphragm kind of goes up and it goes down, all right? So those are all things that we think factor into the increased rate of complications that we see after a BMI of 35. What's the largest BMI I've done? I mean, so, if I get somebody who is very healthy, working out, and is in good shape, I will go and do surgeries for some people over BMI of 35, but it's a case-by-case basis. I get a lot of people, and I also have to, how old are they, so forth, and I have to have a good conversation with my patients and let them understand that, yes, there's a higher chance of infection or things like this happening. I actually showed a before and after. I had a before patient in my office yesterday, 4 months out. She had a massive tummy tuck, okay? We didn't do a plication for her. We didn't do, we did a small plication for her. We didn't do liposuction because we were just trying to minimize the surgery time to minimize her complications. But she's still got an infection. And you know what? We got her through it with antibiotics, but it's risky to do that. And so and I told her that. I was like, but she was desperate. She's like, I can't fit it into clothes. And she had this hump that she's had for ever since she was 14 years old. And some people, they lose some weight and they have this extra skin, and there's not a whole lot that they can do. And so, it's just a desperate situation where, like, all right, let's just get this skin off. That way you can get back into your gym clothes and you can feel a little bit better, get that little next step and keep going down that pathway. Okay, so that's why I do decide to do that, or we do here at our practice, to try to get to that next step for our patients, so they can continue their weight loss journey. The type of anesthesia, Malika, that we do for tummy tucks is generally general anesthesia, meaning that we provide IV and gas sedation, so you're completely out, and then we also provide local at the same time. I generally don't recommend to do a whole lot of liposuction under local, because the anesthesia required for local anesthesia to make it painless can be cardiotoxic. So if you're just doing one area, it can be okay, but if you're doing a lot of areas, you definitely can't do a tummy tuck under local. Okay, if someone suggests that you should do that, it's normally a red flag. It means that they're not a board certified plastic surgeon and they can't do anesthesia in a surgery center because they don't have board certification. So that's kind of a red flag. Okay, so you know, and so other things. If you had a hysterectomy, okay, this is from Tanya. Yes, I mean, endometriosis, there isn't really a relationship with endometriosis and a tummy tuck. After C-section, I would generally wait 6 months. You could probably get away with 3 months, but give your body a chance to heal, give your uterus a chance to contract, right? Because that's going to put pressure onto our plication. Uterus expands during pregnancy. We want that to shrink down. And so give that 6 months after C-section or any kind of major abdominal surgery. And, you know, really talk to your doctor. Try to get down to your goal weight as much as you can. You know, the things that I recommend, if you feel like you're too big for a tummy tuck, there's no doctors that are willing to do it, is number one, this will always work. So take out a pen, take out a piece of paper, or bring out your phone and write this note down. And Google this, intermittent fasting. It always works. And the reason why it always works is because how our body was evolved to eat. Okay, humans did not evolve to eat 3 meals a day. Breakfast is not the most important meal of the day. You guys, that is marketing propaganda that was given out by Kellogg's cereal manufacturer. So people can start eating fucking breakfast, okay? Breakfast is not important. Your body produces its own sugar. You don't need to eat every single day, believe it or not. And you definitely don't need to eat 3 meals a day, okay? Now that might be special for athletes and certain things that we're talking, crazy workouts, stuff like that, okay? But for most people, 1 or 2 meals a day is all you really need, and it's good for your body so you can switch between ketones and carbohydrates, okay? Every time you eat a meal, you fill your body with carbohydrates. Now your body starts using the carbohydrates for fuel, so it's using the jet fuel, right? Your body's using jet fuel when you eat a meal. Now the carbohydrate starts to go down, you get hangry right here because your body's like, okay, where's my jet fuel? I want that. And then you keep not eating and it's like, all right, we're out of jet fuel. Now we're gonna go down to, you know, burning basically like, not jet fuel, but like, let's say kerosene. It's a real slow, or diesel fuel. We're down to diesel fuel. Okay, diesel fuel is ketones. That comes from your body's fat stores. And if you've never gotten off the jet fuel, it is super painful when you get here. You're like, I can't do this. I'm hypoglycemic. I get shaky, I get sweaty. I can't handle not eating. It's a medical thing. Nonsense. It's not a medical thing. It's you haven't switched on your ketone machinery to handle that switch, okay? And so if you don't do intermittent fasting and you start, your very first day you start, you're like, holy shit, this is hard, I'm sweating, I'm getting tunnel vision, I can't do this. I cannot do this. And I thought it was garbage at first too, until I looked at the studies. And it is amazing how beneficial it is. The thing that does happen is it takes about at least 2 weeks for your body to adapt. So if you get past that 2-week period of intermittent fasting, that switch where you go back to ketones, your body's like, oh, I can work on the diesel fuel. It's cool, no problem. Guess what? I'm actually more focused. I can sleep better. I don't have these cravings anymore. I'm not addicted to sugar. Another side note, I had a patient I did a consult with yesterday virtually. She shared a really great bit of information. She lost 100 pounds. And I said, how did you do it? And she said, I was emotionally eating. How many of you guys, give me a wave, give me a thumbs up or heart if you emotionally eat? So every time you go to eat, what are you eating for? Are you eating because you're actually hungry? Or are you eating because of it's an urge, an emotional urge? So what she did, which was a game changer for me in terms of my understanding of this, because I do it too, I think a lot of people do it and we don't even realize it, is she was using food as a drug, okay? And what she did was she started journaling every time that she went to go eat. Why am I eating? She wouldn't stop herself from eating, but she would just start writing it down. She's like, I'm eating because I'm upset about the phone call I just had with my mom. Or I'm eating because I'm just anxious about tomorrow and you know, my job. Or I'm eating because I'm bored. I'm fucking bored. I'm watching TV. I want to have some chips, you know? And she started writing this all down and she realized that, you know what, half the time, if not 60% of the time she was eating was because of these emotional reasons. Her body wasn't actually like physically hungry. And that's something that never really struck into my mind. Okay, so that's a side note, you guys. If you're an emotional eater, just start writing down. I'm not telling you to change what you're doing. If you start writing down the reasons why you're eating, that might give you some insight in terms of some mental processes that are going on in your body, some awareness. Now, awareness is key. You can get into meditation and everything else. You know, that to me was new. But getting back to intermittent fasting. Okay, so now we've gone 2 weeks of intermittent fasting. Your body switches and now it's able to use the ketones. It's off the jet fuel. It can go back and forth. It can now cycle back and forth. It's like, I got this dual machinery, right? I can use the jet fuel. Yeah, I feel great. And then I can go back down. I can utilize diesel fuel without going through a major meltdown. All right, that is powerful for your body because now you're pulling from your fat. And the first few times you start pulling from your fat energy, and you've never pulled from your fat. If you eat 3 meals a day, you've never gone into ketosis to use ketones. So when you first start pulling from your fat as an energy source, right, go into that diesel fuel, you will release a ton of toxins that's been stored in your fat. A lot of toxins in our environment is fat soluble. So those fat cells open up the gates, and that fat that comes out comes with it a lot of the toxins. So a lot of people, when you first start intermittent fasting, be prepared for headaches, be prepared for dehydration, be prepared for electrolyte disorder. So you need to take salt when you start intermittent fasting. You need to take some charcoal if you've never done this before. I had a buddy of mine who started intermittent fasting, and he just took it to the extreme. He lost 20 pounds in like a week. I'm like, look, bro, slow down. He had electrolyte abnormalities. He passed out. He fainted. I was like, he just went too fast. He ended up in the hospital. So you got to go slow. So I recommend people, if you're going to do intermittent fasting, do 12 and 12, meaning that you have a 12-hour eating window and 12-hour fasting window. So you finished eating dinner at 8 o'clock at night, then you don't eat anything, no calories, no sugar in your coffee, nothing, no calories except for water or black coffee until 8 a.m. the next day. That's 12 hours, okay? That's a good goal for your first week. Your next one, increase it by 2 hours. So you go from 8 o'clock all the way to 10 a.m. The next week, you go from 8 o'clock all the way to noon the next day. And that's a good place to be. Some people push the envelope to do 1 meal a day. I'm not suggesting that. You don't need to do that. And then you can also do a whole day of feasting and a whole day of fasting. You know, some people do 5, 1, and 1. But start doing your search on intermittent fasting. If you want one thing that works, you just focus on the time period in which you eat. Eat whatever the hell you want in those 8 hours, okay? This is going to give you serious gains. It's going to get the weight off so that you can come in and get your surgery more safely, okay? I tell all of my patients this. They come in, they ask me, I ask them what they're doing. They try all these different kind of diets. The reason why intermittent fasting works is because that's how we evolved. We're not starving ourselves. This is not an eating disorder. So screw you guys if you think I'm promoting an eating disorder. It is not an eating disorder. It is a more healthy way to eat. It gives your gut a break. It lowers inflammation in your body. When you lower inflammation in your body, such as cortisol, the food that you eat doesn't go straight into fat, right? So there's this whole myth of calorie countings. And I've gone after people, like, oh, you have to count your calories. No, you don't. I mean, it's relative, but it's about when you eat, and then next thing, what you eat. Okay, humans never evolved to eat as much sugar as we do. Okay, so you got to bring the carbs down. Your next step, if you want to take it to the next level. Okay, we're just talking about the single hack, and that's intermittent fasting. If you want to take it to the next level and complicate it, talk about the best kind of diet. The best diet, in my opinion, is how we evolved over 1 million years, and it's a ketogenic diet, right? That's protein and fat. Fat is the most important thing in our diet, and it is the stupid food pyramid should be upside down. It was designed by companies to sell more cereals and grains and things that are high margin so that they can make a profit off of Americans. It was the worst thing that could happen to our health, all right? If you look back in the 50s and 60s, look at how people look. They were eating eggs and bacon, and they were skinny. They're out there working out. See all those workout videos? A few fat people, but not very many. So when you reverse the food pyramid and you put fats and protein at the base, your body's now getting the nutrients that it needs. You don't need to overeat. You don't get these spikes of blood sugar and all this other stuff. Your body makes its own sugar. It makes its own sugar. It will take the fat, it will take the protein, it will make the own sugar for your body. So you can drop your carbs down to 50 grams a day if you want to, and you'd be totally fine. Okay, most Americans eat 300 to 400 grams of carbohydrates every single day, which destroys your blood cells, your blood vessels, destroys your pancreas because guess what? Your insulin goes up to control that blood sugar to get it out of the bloodstream, and then it stays up, and then you get hypoglycemic. And that's where real hypoglycemia comes from, is because you are abusing carbs in the first place. All right, so that's my advice for you. And then of course a little bit of exercise. Exercise has been shown to reverse aging. Okay, there's a distinct aging change that happens between your 40s and 50s, and if you exercise, you don't notice it. And then in between in your 50s and 60s. So that's one of the little hacks, okay? It also improves your brain power. It also helps you lose a little bit of weight. But the biggest thing for weight, in my opinion, for the modern human is getting back to our ancestral ways of eating, controlling the quality of the food. And then now this third thing that I was talking about is documenting the emotional eating and is it a drug? Why are we eating, okay? But even if you are emotionally eating, doing it within an 8-hour window, you'll be able to kind of control your gut inflammation and total inflammation in your body. And I may sound crazy to you guys. I went to a classical medical school. We weren't taught any of this stuff. I didn't learn this stuff until later through my own research. It was actually through the Ben Greenfield Fitness podcast that I was actually listening, and he was talking about fasting. I remember I was on a plane ride. I was like, this guy's talking about fasting. It's such bullshit. I mean, he's not even a doctor. Like, who the hell is this guy? He's a fitness physiologist. And I'm like, I didn't learn about any of this fasting in medical school. And then I started to look at the papers that were out there. And it's hard to find these papers because, normally to find a published study, you have to have a lot of money to put a study together. And so people actually put these studies together and they're relatively low budget, but there was no drug that they're trying to promote and sell. So there wasn't this big pharma behind it, right? But there were studies out there and it shows that intermittent fasting and fasting in general is actually really, really good for you. So I tried it and it made a lot of sense. I got rid of a lot of stubborn areas of fat and I recommend it for all my patients. And it is the only thing that works across the board. And the sad thing is that nobody talks about it. So, all right, so that's how you're gonna get to your goal weight. If you can't get to your goal weight and you still have your extra skin, try to get as healthy as possible. And most likely we will still be able to do your tummy tuck procedure. It just might mean that when you lose more weight later on, that we have to take out that extra skin once you do get to your goal. Okay, so we're gonna move on to question and answers.
I'll read you off for now.
Okay, is hair implants for balding worth it? Yeah, if you're bald and you want hair. There's a guy, Dr. Ziering, in Beverly Hills. He's pretty good on hair restoration. I have no affiliation with him. Question from Life of Vicky. Hi doc, how long does the sensation of the nipples come back after the breast augmentation surgery? A lot of times it varies for every person. I like to avoid the nerves when I do the operation. Even though I go through the border of the areola, there's very little difference in loss of nipple sensation from that. And most likely happens from your dissection. If you dissect too far laterally, you can lose the sensation because the nerves, they come from the spinal cord, they come around to the nipple. They have nothing to do with the incision. And if you go too big with your implant, it stretches those nerves and you can lose sensation. It's rare that I lose nipple sensation because I am aware of those nerves when I do my implant surgery, and we want to protect them at all costs. Most people get hypersensitive right after surgery and then it comes back to normal around 3 to 6 months. Some people they'll lose sensation temporarily and then it comes back at 3 to 6 months. Sometimes that sensation can be, now if nipple sensation is the most important thing to you in the world, like I can't have anything without my nipple sensation, then don't do breast surgery. I tell people that, and the same is true for breast lactation. So if you want to breastfeed, if that's the most important thing to you, well, don't do breast surgery, okay? The risks are pretty low with breast augmentation, but it's still a risk, okay? Bianca, is 19 too young? Bianca B, is 19 too young for a tummy tuck after 66-pound weight loss, and I still want kids later? No, Bianca, it's not, because we don't have to do the plication, right? So that plication is the thing that we get a little bit worried about because that's going to stretch out when you have kids. So we can just take care of the skin and then you just look hot and sexy in a bikini and you have your kids and then if we need to, we can come back and we can tighten things up. But no, you can totally get your tummy tuck, but we may want to just skip the plication. Maybe we do a little liposuction to get rid of the extra the extra fat. Okay, Anthony Pritt, do you handle people with HS? I'm not sure what that is. If you just want to let me know. How much does it cost for a tummy tuck? Ali, shoot me an email, or just guys check out my virtual consult. You guys have questions about pricing? Check out my website, Dr. Daniel Barrett, and go to virtual consultations. Fill that out, fill out your name, information, all a bunch of that stuff, and we can kind of get back to you in terms of pricing. Okay, that's drdanielbarrett.com, virtual consultations. Make sure you check that out. Do you do liposuction under local? Malika, typically I don't, but I can if you really want me to. I typically only limit to one area. Okay, but just ask me the question, Malika. Let me know why you want to do liposuction under local. How much fat, okay, this is from Anita Lopez. How much fat survives after BBL? It varies based on the person and the technique and the procedure, okay? I've noticed anywhere from 30 to 50% of my fat loses after BBL, okay? I do try to get the fat in. I do a lot of techniques to try to get that fat back in as soon as possible because it needs its home, right? You put out fat outside, you know, if you sit it next to the sunlight, it's more likely to die. You wanna get that fat back into the body as soon as possible. So I try to do that for my BBL patients, but anywhere from 30 to 50%. Also depends on technique. If you overgraft, it gets too much pressure. If you sit on your butt, it's too much pressure, you'll lose more. If you're older, if you're 70 years old, you're gonna lose more fat than a 21-year-old. Okay, that's just the sturdiness and durability of the fat. Okay, Crystal Arroyo. What does it cost for fat transfer to the boobs? Is it same cost as breast augmentation? No, it tends to be a little bit higher because with breast augmentation, yes, we have to pay for the implants, which are in a box. But when it comes to fat transfer, we have to take the fat from somewhere. So generally, we have to add in the cost of taking the fat from your abdomen and flanks, sometimes inner thighs, to get enough fat to fat transfer to the breasts. Or Vester Swanson, what is the highest BMI you'll work on? It's variable. You got to rewind and watch the whole thing. I just talked about it. It depends, all right? So if we're 35 and above, we got to talk. I need to know your medical problem, background, your age, how healthy you are, underlying health issues. Yeah, we need to know all that stuff. All right, and then we gotta align your goals and see if we can figure out a safe operation to get you to where we need to go. But you've seen some of my videos. You can see some of the bigger patients I've done, and we work really hard with them to try to get them to their goals. But sometimes you just need a little bit of help, and that's what I'm here for. Okay. Do you film all your surgeries or just certain ones? Getting mine done August 17th. Yes, I don't film all of them. They're up to the patient's discretion, and sometimes if I don't have my incredible social media team, we actually can't film it no matter what, but we do try because a lot of people want to see their surgeries later. They're like, what the hell did you do? And I was like, this is all that I did. You're asleep and I'm working, you know, I'm doing all this. And because here's what happens when you go under for anesthesia for surgery. Like, you wake up, you're like, are you guys done yet? And I'm like, yeah, I was just 5 hours just doing your surgery. Yes, we are done. And you had the best ride of your life. So, yeah, so we do film, and so people can kind of see that later. But generally, it's up to the patient. If you don't want to see it, we don't film. Totally fine, and that's totally okay. I like to more about thigh reduction when whitened. What kind of operation is it? Do you have any patients share results? An example, when whitened, yes. Check out my website, drdanielbarrett.com. I do a lot of thigh liposuction. Sometimes we use Renuvion to tighten the skin. If there's too much extra skin, then we need to do a thigh lift. I like to do a medial thigh lift typically, but there's a line that goes along the thigh that you have to deal with. Sometimes we need to do a lateral thigh lift, and that's involved with the tummy tuck or circumferential body lift if you had massive weight loss. I generally don't see that until you lost about 80 to 100 pounds. And then we can do an actual lateral thigh lift where we bring up the lateral side of the legs. How do we get a copy of my surgery? I mean, I don't know, if you had it filmed by us, then just reach out to us, let us know. But most of the time we do social media, it's just there for 24 hours and then it's gone. But we do have photos, we do documentation of everything else. What's your opinion on ergonomics from Motipa? I gotta look that one up. Do all tummy tucks leave huge scars? Matua 3. Check out my before and afters on tummy tucks. Let me know how bad the scar is. No, they don't. And here's the thing. If you have all this flabby skin in the front of your abdomen, but you have a tiny, okay, and you wear a bikini, right? You're going to see all that flabby skin. You'll be like, hey, everybody. And they'll be like, oh, she's got tummy, right? Okay. Now, if you get a tummy tuck, that tummy looks flat, especially by me. And your belly button looks amazing, especially by me, okay, because I spend a lot of time on that. The incision, yes, it's there. The scar, yes, it's there. It's minimal because we spend a lot of time on that too, but it's hidden in your bikini line. So it's trade-off, right? So if you're thinking that you're just going to be walking around naked your whole life, maybe that's a big factor. But most people, they hide that scar in their bikini line. And even then, you mean the amount of skin we get off is impressive. So yeah, it's a trade-off, right? If I can wave a magic Harry Potter wand and Scarus Icarus Goeus, that's my spell, then I would do it, right? That would be amazing. But we have to have a trade-off. And for most people, they feel like that the effect of that tummy tuck, you're getting that flat tummy with that little scar. It's no big deal. How long do you wait between tummy tuck and breast augmentation? Brittany, Turk, you could wait as early as 3 months to do that. And let's see, what else are the questions we have? Poland syndrome, I watched one of your videos fixing that, Victoria. Yes, Poland syndrome is really tough because it's a kind of more of a medical reconstructive. Question for you guys, does everybody know what Poland syndrome is? Poland syndrome is the absence of a breast, okay? And not only that, but also absence of part of the muscle of the chest. So when we reconstruct that, it's actually really challenging. So we have to use a certain mesh sometimes to kind of expand out the breast and then replace it with an implant later on. So if you have Poland syndrome, give me a call. That's something. Yes, if you have an ileostomy bag, can you still get a tummy tuck? Yes, you can. It's just really challenging. It's something, I mean, I have a general surgery background. I've done ileostomies, colostomies, and it just depends on where it is. We have to work with your GI doc to kind of move it, all this other stuff. But it's doable. Belly button looks sad after lipo. Any fix? Caitlin, yes. So if your belly button looks sad after lipo, that means the lipo was overdone, perhaps, or maybe you just had a little bit too much loose skin and you should have had a tummy tuck in the first place. So generally you can do a skin tightening procedure, minimally invasive using Venus Legacy, which is radiofrequency, or thermage, or the other one is to actually do a tummy tuck, or the last thing is to go back and do a skin tightening procedure such as Renuvion, which uses J-plasma, okay? My recommendation is if you have the sad belly button, you might need a tummy tuck, okay? So if I want a tummy tuck, this is a question from IIMCMX. If I want a tummy tuck and lipo 360 and live 4 hours away, how will post-op or follow-ups be? So 4 hours is not bad. You probably want to spend the night here in town, the night before and the night after, and then you can go home. And then you have to take breaks in the car ride. Okay, you can't be sitting in a car for 4 hours straight. So every hour you've got to get up, you got to walk around, get home, rest, recover, come back at week 1, go home, come back at week 2, go home, come back at week 6. That's kind of the minimum amount of time I like to see it. Now sometimes I narrow that down to just 2 weeks for people that are way out of town, but 4 hours is not too bad. You could sit in 4 hours in traffic and be 10 miles away in LA, unfortunately. So it happens. Okay. Should the abdomen be bruised if lipo was done during a tummy tuck? Me. Yes, you can get bruising because bruising happens anytime we do liposuction. There can be a little bit of bleeding. Blendy Beauty, is a spitting suture common for breast augmentation and lift? Yes, spitting sutures happens all the time. Spitting suture is an absorbable suture that's put in a deep layer. It's meant not to be exposed to the skin, but sometimes the body pushes it out so that you get little spiky things that come out. And it's important just to see your doc, but sometimes you can just trim them and they dive back down underneath and your body does the rest of the absorbing for them. Okay. Vanessa, if I get a mommy makeover, can I still have a baby in the future without getting loose skin again? The answer to that is it depends. So if you get your mommy makeover, you get your tummy tuck, you get rid of all your skin, and you have a baby, your skin is going to stretch a little bit, okay? Now, how much weight you gain during pregnancy matters the most. If you have twins, game over, you're gonna get loose skin. If you gain more than 30 pounds, you're probably gonna have loose skin and it's gonna stretch out. So my recommendation is get pregnant, have your baby, don't gain more than 30 pounds during pregnancy. That is easier said than done. When my wife got pregnant, we were having burgers, we were having like pasta night. I was like, hell yeah, I was like, this is great. I was like, where does this appetite come from? It hit us both. We both gained weight. And that's when I started doing marathons and Ironmans because I was like, shit, I cannot, I was like over 200 pounds just because my wife got pregnant and I'm not even carrying the baby. I'm just being super selfish. So, all right, mini versus full tummy tuck. Amanda, that depends. If you've had a kid, you're gonna need a full tummy tuck, all right? If you've had a kid, you're gonna need a full tummy tuck. Now, what does that really mean? All right, that means that we're able to take the skin above the belly button. And the reason why people don't like the idea of a full tummy tuck is because they think it's this big giant scar, okay? And I think it's gonna mess up the belly button. But if you, I promise you, a beautiful belly button, full tummy tuck is always a way to go because then you can get that beautiful plication of the muscle so that instead of you having that poochy abdomen in the front, we can now tighten that up. So now your abdomen is flat and we get all of that skin and we get the belly button looking beautiful. So mini versus full tummy tuck, definitely go the full tummy tuck. Now mini tummy tuck's not bad if you just have a little C-section scar down there. and you're just one of these super people that you don't have the sad face on your belly button. If you have the sad face on your belly button, you have too much skin above the belly button, go for full. If you don't have that, then a mini tummy tuck might work, okay? And that can happen for people with just a little bit of loose skin from excess weight loss, okay? Does insurance cover tummy tuck? We have a surrogate who wants one after our baby. Typically not. You have to have a lot of massive weight loss to cover a paniculectomy. Paniculectomy is just removal of the skin. A tummy tuck includes removal of the skin and plication. And here in my office, we do kind of a grand slam tummy tuck. We do liposuction. We do all these kind of combination things, to really make it fantastic. Okay. So what else we got? Is lymphatic drainage actually required for tummy tuck? No. It's not. It can be helpful for some people. Some people swear by it. I haven't seen the studies on it, so I don't recommend it either way. But people that get it, they swear by it. I think anytime someone touches your body, it feels good. For the most part, wanted to touch. Okay. Do you use sutures that aren't dissolvable? Yes, I do. I use a combination. Jalisco. I use a combination of absorbable ones deep down, and in the skin I use removable ones because I don't want the inflammation to be in the skin. Anytime you use absorbable sutures, you have to dissolve those sutures by your body attacking it. Okay, we're going to have time for 2 more questions. So that's why I use non-absorbable in the skin. Okay. Are you able to do donut lifts on patients that want a reduction lift with small? Are you able to do donut lifts on patients that want a reduction lift plus a small implant? Are you able to do donut lifts on patients that want? Totally depends, Renee, on your exam. Okay, so is lymphatic, okay, and then does insurance cover tummy tuck? Okay, we talked about that. And you use sub-Q4 monocrol. Rob, I typically use PDS. It's a great question though, it's kind of specific. How do you know about sutures? Are you a doctor? That's great. No, it's good. I mean, if you know the detail of the suture, monocrol sometimes spits less, but I've noticed the scars widen a little bit more when I use monocrol, so I try to stay away from it. Do I have a recovery house or work with one in my state? Yes, we do. We have recovery houses for people that get that surgery. So they take care of you. They're amazing. There's like 3 of them here in town because this is a mecca for plastic surgery. You guys, you're going to get plastic surgery. You're going to travel somewhere. Come here. Beverly Hills, right here. Okay? We get one more question. Can you get a BBL if you don't have colon? Yeah, sure. Why not? Okay. I'll do another question. That was too easy. That was too good. Okay.
The Sculptra for butt lift work.
Okay, so Sculptra for butt lifts, that's if you don't have a whole lot of fat. Generally I like to use people's fat for a BBL, but if you don't have Sculptra can kind of give you a nice boost, especially if you're very, very skinny. It doesn't last forever and it can be really expensive. The good news is that you don't have to be under anesthesia and you don't have the risk of dying that you do have with a BBL, okay? So that is it. You guys, we are done with the questions. Thank you for watching. Again, if you want more detailed information, check out my website, drdanielbarrett.com. Leave your information on our virtual consultation page, okay? And we will get back to you in terms of pricing, any other questions you have. Also, if you're on my TikTok, check out my Instagram, drdanielbarrett.com. And if you're on my Instagram and you want to check out my TikTok, it's Barrett Plastic Surgery, you guys. We would love to cross-pollinate. And the mecca of everything you need to know about this stuff and tummy tucks and breast stuff is on my podcast and is on my YouTube. So check out Dr. Barrett Plastic Surgery YouTube, and you're going to see a whole library. I have everything you need to know about liposuction, everything you need to know about tummy tucks, everything you need to know about breast augmentation. And you could ask questions on there and I'll actually get back to you. But most importantly, it just summarizes everything that you might possibly need to know. In my opinion, I like that transparency, so you know, and you can actually tune into the podcast, which is the same version of the YouTube, and you can just listen to it on your car ride and you're going to be an expert at the end of that. Thank you guys. We'll see you next week.